James. Okay. And whenever you press the button or whatever. All right, thank you. Good morning, everybody. I'd like to call this meeting to order of the Public Health and Human Services Board for Cook County at 8:36 a.m. on Tuesday, April 18th, 2023. Let's see, first thing is the consent agenda, which includes our meeting agenda and the minutes, financial report, and abstracts and bills. Anything someone would like to pull from the consent or change or what have you? Else, I'd entertain a motion here.
Motion to approve.
Thank you, Commissioner Storlie. We have a motion. Is there support?
Second it.
Thank you, Commissioner White. We have motion and support. Any further discussion? Hearing or seeing none. All in favor? Aye. Opposed? Motion passes unanimously. Thank you. We've got our agenda. Let's rock and roll. Next one is the welcome of the new staff, and I'll hand it over to Allison here.
Good morning, Commissioners. Very excited this morning to be welcoming 2 new members to our behavioral health team. Dana Logan, starting today as a mental health worker, and Brenda Port, also starting today as our substance use disorder and co-occurring disorders case manager. So we're thrilled to have them both on staff. They both come with a great deal of experience in human services, in supporting people with substance use treatment and recovery. Great access to our team. So we're glad to have them here on this Stone Tuesday.
Welcome, happy first day, and thank you so much for joining the team. We've been lacking for, or navigating, juggling for quite some time, and your experience is going to be invaluable for us. Any questions, or would you like to say anything? Or?
Maybe introduce
Yeah.
yourselves. Tell us a little bit about yourselves.
Good morning. My name is Dana Logan. I am the adult mental health worker. I am from Grand Portage, so I travel in every morning. I have been a resident of Cook County for 33 years. So I've served on different committees, both in the county and on the reservation. I worked for the tribal government for 17 of those years. And I decided to go back to school and go to school for social work. And I'm a senior in the social work field at Scholastica this year. And I've worked in different positions, working with homeless families and children in Duluth. Also at Muscausen Treatment Center, I have my CD certificate and have worked with people with substance use disorders. And I think that's it. So thank you, and it's really nice to be here.
Thank you.
Thank you. Welcome. We're happy to have you.
Hi there, I'm Brenda Port. I came originally from Dispatch. I just worked at Dispatch. But prior to that, I was a drug and alcohol counselor and a social worker for Fond du Lac Reservation in Cloquet, where I'm from. I've done a gamut at the tribe, from licensing, foster care, supporting people, finding housing, drug and alcohol counseling, referring to treatment. I actually did work at Muscausen as well.
Oh, wow.
And I currently live in Silver Bay. That's where my fiance is from. So that's why I'm here.
Thank you. We are so lucky to have you guys join the team, and yeah, really looking forward to the work, and you as well, John.
Exactly
right?
That.
Yeah. Yeah. Any questions or anything? Yeah, please.
Well, not a question, but Dana was in decades past, she was our tribal council, and I was my very first meeting up in Grand Portage, and she was there, and she was the face that just seemed so safe. So welcoming, and because I didn't know what anybody was talking about or who anybody was. And so we have an asset here. So thank you.
Any other comments, questions? All right. Well, thank you for introducing yourselves, and we get to see your faces and you can see our faces, and any concerns, feel free to yell at us, and also at John and Allison. But yeah, just hope you have a wonderful day and carry on. Thank you.
So we're going to excuse ourselves to continue orientation. So thank you.
Thank you,
Thank
John.
you.
That is very exciting, and then, I guess we'll probably hear more in your update just about staffing levels and where we're at there. So for now, we'll move on to our staff report, and this morning we have Lori Erickson. Good morning.
Good morning.
And I'll hand it over to you.
Thank you. Good morning, Board. Okay, the full year-end financial report is attached to today's agenda, and it's also available online. This presentation is going to explain a little bit behind the numbers, what it is that we do in Public Health and Human Services, which I will probably refer to as PHHS throughout the entire presentation, because that's a lot of words to say. I'm going to be showing you some graphs and charts from the report. It'll provide a little more context to all the numbers that you're seeing. And here we go. So there's our financial report. Revenue that we received was 4% less than what was budgeted. Some of our federal and state aid is based on the amount of personnel expenses that we report, such as wages, training and travel, supplies, software licenses, or program materials. Since we had reduced personnel expenses due to vacant positions, our reported costs were less, and therefore our revenue was correspondingly less. We'd also budgeted to use some of the federal funds for the American Rescue Plan to support the crisis pilot project, but we did find other funding through the Adult Behavioral Health Initiative, so that we did not access those funds this year. Overall, expenditures were 13% lower than budgeted. This is partially due to the reduced personnel costs from the vacancies and reduced out-of-home placements. We were prepared to use up to $100,000 from fund balance for out-of-home placement overruns, but that was unnecessary. Therefore, we have an excess of collections received over the expenditures paid of $374,212, and this is a return to fund balance.
Awesome.
The PHHS funding comes from these specific areas. Federal and state grants made up 36% of our revenue in 2022. Fees and recoveries, including reimbursements from health insurance plans and license fees, made up another 9%. A very small amount of revenue came from non-governmental grants and donations, and the remaining 51% of our revenue came from county tax. All of PHHS expenses fall into one of three departments: social services, public health, or economic assistance. Here's our PHHS org chart as of the end of 2022. On paper, it looks like a lot of staff. However, there is very little overlap or redundancy in services. Rather, many of these people wear multiple hats in their public service roles. As I go through each department in the report, you'll hear more about the work that each team provides. So starting on the left, the last three columns here in blue are the social services team. The first column represents the adult and home and community-based services team. There's one supervisor and 6 social workers, each with a different case management or care coordination specialization. They provide adult protection, waiver case management, long-term services and supports, intellectual and developmental disability services, and min-choice assessments, among other things. There's also one social services case aide who supports this team. This team also has several independent contractors who provide in-home support services to the aging population. Still within social services, the next column is the children and family services team with one supervisor and 2 social workers providing child welfare, child protection services, family assessment response, and parent support outreach services, among many other things. And then there's also one child care licensor who in 2023 also became the community child care coordinator. The social services case aide also provides support to this team as well. Arrowhead Economic Opportunity Agency, or AEOA, is under contract to provide employment and training services to people on the Minnesota Family Investment Program, or MFIP, as well as the Diversionary Work Program. The last area in social services is the behavioral health team with 1 supervisor, 4 social workers. They all provide substance use disorder services, children's and adult mental health case management and therapeutic support services, and 2 mental health workers, 1 providing skills and adult rehabilitative mental health services, or ARMS, and 1 piloting a crisis response collaboration project. The social services case aide also provides support to this team as well. Contracted providers for this unit are the Wilderness Outpatient for comprehensive assessments, outpatient treatment, and inpatient substance use disorder referrals, and the Sawtooth Mountain Clinic for mental health clinical supervision. Next up in red is the public health team with 1 supervisor and 3 public health educators who meet all 6 areas of Minnesota's public health responsibility within the Local Public Health Act. The Office Support Case Aide provides additional support for the public health team. This team provided regional collaboration, grant writing, contracts management, emergency preparedness, vaccine planning and implementation, case investigation and contact tracing, and liaison to the schools and businesses in the community, as well as the coordination of many community volunteers. Using contracts with Sawtooth Mountain Clinic and North Shore Health, Cook County provides several additional public health programs, such as the home care sliding fee program through the hospital, child and teen checkup, home visiting, SHIP, and WIC. And I'll go through each of those later. Next up in green is the Economic Assistance Team, consisting of 1 supervisor and 4 eligibility specialists who provide eligibility determination and revalidation reviews for many state and federal support programs, such as cash and food assistance, housing support, several healthcare programs, child care assistance, and they also process applications for emergency assistance and county-funded burial support. 1 case aide provides coordination of the healthcare access program. The office support case aide provides additional support to this team as well. Child support services in Cook County are provided through a contract with Carleton County. And since it's Administrative Professionals Day next week, I get to do a little shout out here and acknowledge our administrative staff for the important work that gets done behind the scenes at PHHS every day. This includes our director, providing agency management and leadership and local, regional, and state collaboration, our executive admin assistant, and 1 office support case aide. The admin team supports our citizen advisory councils, orders supplies for our office and programs, maintains the PHHS social media and outreach, and provides treatment financing coordination for our SUD clients. The admin team also includes fiscal services with 1 supervisor, a fiscal officer, and an accounting technician. We provide the budget, pay the bills, receive the revenue, operate the Social Security RET Payee program, provide complex grant management and reporting, and provide regular financial updates to this board. And big kudos to my team if you're listening. Thank you for all the work you do.
Hear, hear.
Hear, hear. Yay. Costs that benefit the entire agency are split between 3 departments. This includes all the admin wages, postage and copying costs, office supplies and phones, training and travel for the administrative staff, travel and per diem for the advisory boards, fees to the state of Minnesota for the merit system and state IT support, as well as funds that are transferred to the county general fund for the courthouse office rent, the county MIS costs, the labor that MIS department does for us, liability insurance, and the annual audit. As I drill down into the 3 departments, you'll notice a line item in each one of those budgets for an administrative allocation, as these admin costs are then split proportionally between the 3 departments: economic assistance, social services, and public health. Why does it look like it's muted?
It is muted.
Okay. As long as people can hear me.
You're not muted, but just the TV itself.
Perfect, thank you.
Am I muted? Just kidding.
I can hear you. Starting with the Economic Assistance Department, the 2022 actual costs and revenues were within 99% of the budget. The biggest variance can be seen in the client programs area, where we saw an increase in reimbursable costs and then an offsetting increase in state and federal revenue. The amount of federal administrative revenue that we received for child support services was a little lower than expected, but overall, budget to actuals were pretty much on target. There was a 46% increase in client program costs in 2022, and thus there was a corresponding increase in reimbursements. This comes from the state reimbursable assistance that we provide to clients. The county provides assistance for cost-effective health insurance and Medicare Part B insurance premiums to eligible recipients, and then we receive nearly 100% reimbursement in return from state and federal sources. We provide provider transportation, which allows community volunteer drivers to assist eligible elderly clients with medical rides. The state reimbursed us 84% of these costs. Healthcare Access provides assistance to eligible residents to reimburse them for using their own transportation and medical lodging, and then the state reimbursed us 96% of these costs.
For the provider transportation, for what the state doesn't reimburse, then that's levy dollars that covers it?
Correct.
Okay, thank you.
The state will only reimburse a very, very minimum amount, which is like 22 cents a mile.
Okay.
Taking somebody to a doctor appointment, and then they do not reimburse anything for letting somebody drive back to their place of residence while they're leaving somebody there. So we make up a little difference for that. And the reason why is so that we continue to have people that want to do the service.
Absolutely.
Do the service.
Thank you.
Federal and state funding made up 55% of the revenue received for economic assistance. This includes federal administrative aid, which supports some of the payroll costs of the staff that are providing eligibility services for state and federal programs, as well as reimbursement for those county-paid client assistance. Fees and recoveries made up 2% of the revenue. The county is required to perform collections on behalf of the state, and in return, they allow us to keep a very small token proportion of it. For instance, if we're doing medical assistance and state recoveries, depending on what type of a program the recipient was receiving when they accepted medical assistance, the funding that we collect for it on behalf of the state, they may allow us to keep up to 25% of that. The remainder of the funding for the economic assistance area came from county tax.
Lori, excuse me, how much of that is match dollars for federal dollars? Do we have to match federal dollars, or
Not in economic assistance, no, we
Okay,
don't.
gotcha.
Good question.
Thanks.
There were 255 new applications for assistance in 2022. This is up significantly from the prior 5-year annual average of 186 applications. As you can see, the largest increase last year came from people applying for food support assistance.
And so new applications has not a lot to do with the waiver, the emergency.
No, these are not renewals.
Mm-hmm.
These are just brand new applications, people seeking support. Since 2013, child support services are provided by a contract with Carleton County. They provide case intake and assessments, establish paternity, and locate absent parents. They establish and enforce court orders for child support or spousal support. They collect on current orders and on cases with arrears. Their 2022 stats show 126 open Cook County cases. For all 3 units of the Social Services Department, costs were 19% under budget, and revenue received was 4% less than anticipated. There were several vacancies that remained unfilled at the end of the year and into 2023. This led to a reduction in personnel costs and the associated federal and state aid. Biggest variances were in children and family services, including out-of-home placements, where they expended 39% of their budget. Mental health services expended 51% of its budget. On the revenue side, some state and federal allocations are based on expenses and data and client counts from prior years. Thus, we received more revenue for foster care aid than we expended in 2022 because it was based on previous year's numbers. The state tends to do that a lot. Well, they'll take a look at the data from 2019. Oh, you needed more money, so then they'll give us more money in 2022. Oops. Let me go back. Administrative aid for comprehensive assessments was also lower than anticipated. We had lower reimbursement revenue in other programming areas, and which that corresponds to the lower expenses that we had in those areas. Federal and state aid made up 29% of the funding for the social services revenue. That's up slightly from 2021. Fees and recoveries funded another 13%. This is from my staff that bill for the health insurance companies for client waivered services, care coordination, and targeted case management. A small portion of the revenue came from non-governmental grant, the Adult Behavioral Health Initiative funds, and the remainder from county tax. A few stats from each of the areas in social services. The number of staff hours in children and family services was down from 2021 due to vacancies in this unit. The number of children in out-of-home placements continues to remain low and saw a decrease over last year. This includes children in foster care homes, group homes, mental health residential treatment, or correctional facilities. PHHS contracts with the Arrowhead Employment Opportunity Agency, or AEOA, to provide employment and training services for recipients on the Minnesota Family Investment Program, or MFIP, and the Diversionary Work Program, DWP. In the last couple of years, the number of clients who were required to participate in these services was reduced due to the state waivers that were in place during the pandemic. PHHS contracts with Wilderness Outpatient Treatment Program to provide comprehensive assessments and outpatient group or individual treatment services, while our staff provide the coordination with facilities for inpatient treatment and financing. In 2022, 43 comprehensive assessments were conducted, and inpatient treatment was coordinated 19 times. 11 people participated in outpatient treatment services through Wilderness Outpatient. The Wilderness Outpatient Treatment Program contract is funded mostly by county tax. 11% comes from federal and state aid, and 2% from private paying clients or insurance fees. This program also receives 1/2 of the liquor license fees that are collected by the county. Hours worked in the mental health services unit was up slightly from 2021. This unit also had several vacancies in 2022. 2 of them were just filled today. The number of adult clients receiving mental health services has fluctuated in the last 5 years, while the number of children receiving services has decreased for the first time in the same period. You'll see the phrase work groups mentioned a few times in my presentation here. If most of us are familiar with what a case is. Think of a case as being a container that holds all of the work groups associated with one household or one family. Work groups are the individual programs that are being served by the people. So there can be individual programs such as child welfare, mental health, developmental disabilities, or other adult services. So each one of those work groups, there could be 10 work groups in one case, if you think of it that way. The number of clients receiving intellectual and developmental disability services has increased in the last 5 years. This also includes clients receiving CADI services. That's the Community Access for Disability Inclusion, which is home and community-based services to children and adults which require the level of care provided in a nursing facility. This helps a person live as independently as possible in the community rather than outside. The Adult and Home and Community-Based Services team also experienced turnover last year, resulting in less reported staff hours. The adult services also supports our aging community members who sometimes need a little additional help to remain in the community. The in-home support program coordinates local independent contractors to provide homemaking, chore, and transportation services so that people can remain in their own homes for as long as they would like. Many of the costs provided for these services are reimbursable through the recipient's waivers through the state. We've also seen a steady growth in the number of people that are seeking these services. However, due to the lack of service providers in the county, there has been a waiting list for people to receive services for the last several years. Moving on to public health. In 2022, costs were 2% less than budgeted, and revenue received was 8% less than anticipated. The SHIP contract ended midway through 2022, resulting in lowered contracted services. Personnel had budgeted for a use of specific COVID-19 grant funds in '22, but we were allowed to charge non-grant costs for 2 of the public health educators to the American Rescue Plan instead. This resulted in lower revenue in this area, but means we'll be able to use these COVID grant funds for these staff in 2023 as well. 43% of the funding for public health comes from federal and state grants, 2% from non-governmental grants and donations, and the remaining from county tax. The public health team reports their costs across the 6 areas of responsibility of the Minnesota Local Public Health Act. In 2022, the costs were allocated as 12% assuring the adequate local public health infrastructure, 8% protecting against environmental health hazards, 6% assuring health services, 7% preparing and responding to emergencies, 12% preventing the spread of communicable diseases, and 55% promoting healthy communities and healthy behaviors. The public health community grants are awarded to community agencies through a competitive annual grant-making process. A subcommittee of the Public Health Advisory Committee makes funding recommendations each year, which is presented to the Human Services Board. Grants are made in line with the goals that are set forth in the Community Health Improvement Plan. These represent areas of the essential community services that would go unfilled without the support of this grant-making fund. And this is a list of the 2022 recipients of the public health grant funds. So overall, in the 3 departments that make up PHHS, we saw a decrease in budgeted expenses and a slight decrease in planned revenue. This resulted in an excess of revenue received over costs of $374,212, which will be returned to the PHHS fund balance. So you always hear me talking about the fund balance. For new member of the board, as well as some of the listening public, I want to assure you that the fund balance is not a slush fund or a rainy day account. Because county operations rely on property tax levy, the Office of the State Auditor requires us to hold a reserve account that is no less than 5 months of our budgeted operating costs. 5 out of 12 months is 42%. This is where I come up with that. This requirement allows the county to maintain operations during the first 5 months of the year before the first half of property tax collections arrives in May and is then distributed to the departments. A healthy fund balance allows the county to fund unbudgeted expenses that arise after the budget has been set also. The county recommended fund balance for PHHS is 40%. The highway department is 60%, and the county general fund target is 75%. So that's a lot of pretty colors. Let me explain it. To know how much that we need to keep in reserves, we first look at our annual budget. The blue bars on your screen represent the annual budget going back to 2018. The red bars represent 42% of that budget. So that's the amount that we must have held in reserves to meet the first 5 months of the expenses of those blue barred budgets. The green bars indicate the actual amount that PHHS held in reserves for each of those budget years. It wasn't all that long ago when our fund balance fell below the state-required bare minimum. However, in recent years, due to a decrease in planned expenditures and an increase in our third-party billing efforts, we've reported excess of revenue over costs, resulting in a large return to fund balance in several years. In 2023, the PHHS budget also includes a use of fund balance of $656,881 for the event of unbudgeted out-of-home placements in '23, the child care subsidy grants, as well as the increase in staff wages due to the comp study. So you see the approved budget reduced, the amount in the green bar in 2023, that's the amount of reserves that we have, but I reduced it down so that you could see how much of it is being held for a specific purpose. Still, PHHS has a very healthy fund balance against even the bare minimum requirements for the reserves. But this is what it would look like if PHHS were required to hold 75% in reserves like the rest of the county general fund is. This is just a comparison to show you that we do have a lot of adequate reserves to fund one-time projects or to reduce levy burden for unknown placement costs when I'm preparing the budget. Again, here's our final budget to actual financials for '22. Does anyone have any questions?
How do you do it?
It was a little challenging. It was playoff hockey last night. It was kind of hard to sit and do this.
Mr. Chair?
Yes, please, Commissioner Storlie.
Thank you. Thank you for this report. I followed along as best I could, but there seemed to be a difference between what you had here and what we have here.
The
Paperwork.
The presentation will be in the minutes with all of the graphs.
Well, according to my page 4, under expenditures, rent, $57,000. What does that mean?
Well, there was a little miscommunication between Brady and I in 2022. I thought he was going to charge us $57,000 in rent, and he thought he was going to charge us $56,000 in rent. We do pay rent. We are the one department that pays rent back to the general fund to use our office space upstairs.
Okay.
And then that's reimbursable, right?
There is a cost allocation plan that is put together that takes a look at what services the county provides for PHHS. The auditor's office provides collections of the property taxes, and then they distribute the property taxes. The auditor's office also provides payroll services. The maintenance department provides us with upkeep in our offices. So in turn, we are paying rent to use our office space. That becomes a large expense for us. In the cost allocation plan, it's looked at how much we are paying in rent, how much we are paying other areas of the county for support. Then the federal government gives us federal administrative aid to offset those costs. We turn over all of that federal administrative aid to the auditor's office to use in the general fund. This cost allocation plan takes a look at expenses that we paid 2 years prior to determine how much aid we're going to be receiving from the federal government in the future. Nothing happens at the same time. So yes,
Simple, right?
the more rent we pay, the more revenue we get from the federal government to replenish the general fund.
Commissioner White?
And is that 100% reimbursement that you're getting to?
It is not. It is not 100% reimbursement. Over the course of the year, we will pay the MIS department $50-some thousand. The rent is $56,000. Other areas that we're paying for, I can't remember exactly how much we paid in the last 2 years, but I believe it's around $100,000, $100,000 to $125,000 that we get in federal aid that goes directly to the general fund.
Commissioner Hawkins?
Thank you. I have a question, and I guess it's on the mental health services revenue side. There's grants listed there, and then no in the budget, but then no corresponding revenue. Is it because we haven't I'm assuming sometimes grants are reimbursable. You have to submit expenses, or maybe you got the full grant at the at the beginning, and I'm just curious how that worked.
Sure, let me take a look here. Mental
And this
health.
is page 10, I think, in our packet of that.
Yes.
Yep, okay.
Page 10 of the report.
So under mental health services, the crisis response ARPA fund, we had planned on using the federal ARPA dollars that the county received to pilot the crisis response project, but we were able to secure funding from the Adult Behavioral Health Initiative, so we ended up not using those funds. So that was money that we were anticipating using that we ended up not using. Let me see what else we had there. Children's Mental Health Rule 5 reimbursement, that's children that were in mental health placements. We did not have any children that were in mental health placements in 2022. So we anticipated receiving some supportive reimbursement dollars for that, but again, as you suggested, we didn't have that expense.
Okay, so it's because we didn't have the expense that we didn't get the grant. That's
Correct.
what I was trying
Yep.
to just make sure that I understood why we didn't get the grant when we were told.
Right.
We're expecting it.
We do have in some instances where we get allocations where the money comes first, and then we have to submit reports to show how much it was that we spent of those monies or return them. This happens with the opioid grant that we get from the state, which is not the opioid settlement dollars, but we get an additional grant from the state to use for specific purposes in the area of child protection and child welfare services. Those monies we get at the beginning of the year, and then we spend it during the year and we submit a report, and then we get to keep what we spent. In other areas, we spend the money upfront first, which is why there's a reason we need to have that fund balance, because we're spending money first. We are submitting reports to the state at the end of a quarter, and then 2 to 3 months later is when we get that money back from the state. And this is also a reason why this report is delayed coming to you every year, because at fourth quarter, from October to December, we are spending money by the end of January, we are submitting those reports to the state, and then we get those funds in February and March.
So this is,
Yes, this is
Whatever
this is on the modified accrual basis.
okay,
and so-
that's what.
Correct.
So when, I was just curious, children's mental health, other recoveries, and then it shows the revenue is 4,000 negative. So is that because we spent the money and didn't get?
This was because the state does, again, they're a couple years behind in everything, and so as they're reconciling things, they realized that they gave us some money a couple years ago that we didn't spend, and so they send us a bill for it 2 years after the fact.
Okay. Thank you for the clarification.
Absolutely.
Thank you. Questions? Any other questions?
Thank you for your time.
Thank you
Thank
so
you.
much for your work, and I hope all the administrative staff can celebrate on
I hope so too.
the day.
I appreciate the thoroughness of your report. I really do. I love these kind of things.
And just want to applaud again, I think Commissioner Sullivan did, receiving the letter, just the outstanding work from your department.
Yeah.
So, thank you.
Just incredible.
Thank you.
There was no errors at all.
Yeah. How is
Were
that
no.
even
No.
possible? That's
The fiscal
just
team
amazing.
rocks.
There were no. Where's Bo?
And I would just like to say that your report is very enlightening, because, I mean, there are, what is the public health, human services, what do they do? And so you've helped to bring, to get it more refined as to what is happening. And it's a big question. It's not being, to be critical or to be on the offensive, or to be on the offensive, but it's just totally, to some people in the community, it's just a totally unknown organization as far as ever having been in their personal lives, so.
And I
It was
usually
helpful.
try to tell people that what we do upstairs isn't always seen. You don't see, we're not buying a dump truck, so you don't see something tangible going down the road that you spent money on as a taxpayer. And many people aren't aware of the services that we have if they've never had to use those services.
And to that end, I think there's great value in telling people what you do, even though, I mean, you don't need to I mean, it doesn't have to be confidential information, but the community, as we all know, is not always listening. And so it benefits us all if this group of county employees explain repeatedly or share repeatedly what is going on. I mean, it's not a negative thing, it's just that there's value in knowing, positive value for everyone, and it just makes it better, I would believe. I mean, I know it makes it better for everybody to know.
And Lori does a very similar and just as thorough presentation every year, and we try to bring in staff every month to give staff reports about the services that we do provide. But yeah, like you say, you can't say it enough, and we got lots of horns to toot. But it's
Well, they have a lot of horns to toot
Yeah.
in their departments, and that is a department. I mean, you're right. That was a pretty impressive loader down at the highway department. My tax dollars are sitting right there. But the other pieces that you do, I know it is out there, but it needs to be out there more often in different venues. It doesn't have to be a whole article, just a little, oh, by the way, you know that we helped 158 community people pay for their food, or something like that. You know what I mean? You don't have to go on about it. It's just like, because too much information that is brought in, many brains cannot hold on to more than the first one or two pieces of data that come in. And so we can't really digest it all, even if you get it all. So you just need to do this. Be proud of what you do, that's all. And I'm back to the PHHS acronym. Public Health and Human Services. If it has value, then you would say Public Health and Human Services to remind people of what you are offering. I mean, there's great value in that, but the PHHS is like, I don't know, poor hungry hippie society. I don't know. I mean, people can have a lot of fun and get deviated from what Public Health and Human Services is. So I think you're doing yourselves an injustice by not saying, when you are speaking.
We are the Public Health and Services Board. We can dictate to never say the acronym again.
Well, then if that's the case, publicly, I mean.
Is that a motion, Commissioner?
No.
Challenge
No,
accepted.
I'm not going to micromanage, but I'm just saying, I mean, I think there's such value in that. It's a
Yeah.
suggestion, and it's like,
Yeah. Say the words, right?
well, it's not going to, death is coming if you say the whole word or you say the acronym. So if you put it out there, there's value in it,
Yeah.
particularly in public health and human services.
Sure.
And you don't need to placate me because I don't need it.
I don't think you can be placated.
So, that's it.
Thank you. Any other questions? Comments? Well, have a wonderful day.
Thank you.
Thank you for your work, and I look forward to. I'm hoping to pick your brain a little bit, and this is just a dream at this point, but just trying to navigate some of our other community needs, and if we can get creative with different programming to try to help more of our seniors and those that are struggling to do some kind of comprehensive. We're picking away at childcare. I think we're all also very concerned about our seniors, and I'm just hoping to get, and transportation, of course, too. I'm just hoping we can start developing something, and I feel like you'd have a wonderful perspective there, so.
Thank you. Looking forward to it.
Good. All right. Moving on to item 5, our director's report. Allison.
Yes, thank you, Lori. You are a hard act to follow. Always do such a fantastic job. Go Wilds. Okay. Staff updates. We'll start out. You got to meet 2 of our excellent new hires this morning and hear a bit about the background that they bring to their roles, so I won't spend too much time on that. We have also extended an offer that was accepted and approved by the board for our family services case manager position. This is a role that has been vacant for many, many months. We are thrilled to have, again, another qualified staff coming on board in May to
serve in that role. That will be Amanda Anderson. This is not Amanda Anderson, the dispatcher. Just want to set the record straight there. Amanda does have ties to the community and is coming from most recently Fond du Lac Social Services, where she has worked as a foster care licenser. That leaves us with just one current vacant position on our team. That's our adult mental health case manager position that was recently vacated by Anna Ross's transfer from the mental health team to the adult services team. Still recruiting for that position. We also have a vacancy anticipated with Matthew Baxley's resignation effective today. You'll hear a lot more from Matthew, John, and myself about Matthew's work over the last 6 months in that coordinated mental health crisis response pilot, some of the recommendations from our findings from the initial months of that pilot, and next steps with that position. And again, that's at the Committee of the Whole later this morning. I'll start with an update from our economic assistance and healthcare team. You heard last month from me about some of the waivers that are ending effective with the end of the public health emergency. As you saw from Lori in the presentation this morning, we are seeing an increase for new applications that has slowed down a bit since that initial surge in January of 2023. The team is preparing for those public health care program renewals to resume. So that includes eligibility redeterminations for medical assistance, Minnesota Care, and the Medicare Savings Program, which helps seniors and persons with disabilities get funding for their Medicare premiums. Approximately 1,273 medical assistance enrollees, or around 600 cases, will need to go through that renewal process locally between July 23rd and July of 2023, that is, and June of 2024. Our staff, under the leadership of Allison Plummer, has begun a great deal of coordination and communication with community partners like Sawtooth Mountain Clinic and their Minshire Navigator, North Shore Health, and their social work staff who work in the long-term care eligibility processes, and Grand Portage Health Services to offer support and information on how to assist enrollees in maintaining eligibility. We will continue to work on outreach for enrollee awareness, so as you have any recommendations on how to increase our ability to get the word out to enrollees or community partners, welcome any recommendations there. We did distribute 2 media releases in the last few weeks that was sent out to the newspaper, radio, local media outlets on these upcoming changes, both with healthcare eligibility as well as the end of the emergency SNAP program. The legislature recently appropriated funding for federal fiscal year 23, so beginning in July, to offset the cost to counties and the Department of Human Services to undertake this massive volume of work to redetermine eligibility for the many individuals who are currently eligible for medical assistance statewide. Internally, we anticipate using those funds to offset any cost of overtime, training, and outreach for our staff. We do not anticipate having to add any positions or bring on any temporary staff to undertake this work at this point. Our public health team is very busy this month and next. I'll give a heads up on an opportunity that we're exploring within that team, as well as a summary of some of the initiatives that they're currently working on. In the upcoming weeks, Andrea Orist and Andrea Tofty from our public health team are co-presenting with Kristen and Jen, who are 2 nurses at Grand Portage Health Services, on our successful partnership during the pandemic across county and tribal systems. So that will be at the Statewide Public Health Emergency Preparedness Coordinators Conference. We have several staff that are also attending a shelter training in Virginia upcoming to increase our skills in that area. That's Virginia, Minnesota. The Emergency Services Conference is coming up. Our staff have been involved in helping to plan and promote to that conference. And we also have staff who are presenting topics or have been involved in coordinating some of the presenters for that conference. Again, more information on the county website on how to register for the Emergency Services Conference. It's the 31st annual. I'm really excited to be offering that again this year. In the area of active living, safe routes to school, and the Statewide Health Improvement Partnership, our staff are supporting an active living steering committee table at the Earth Day Fair coming up. We have a lot of bike safety events coming up in early May. Again, you can find a media release on the website with a lot more information on these events, but we will have representatives from Bike Minnesota up here in early May for a number of workshops and trainings to train community members, educators, others who work with youth on a variety of bike safety techniques and skills. We also have Bike to School Day upcoming on May 4th. In the area of substance use disorder prevention and mental health promotion, staff coordinated 2 well-attended mental health first aid trainings that were provided free of charge in partnership with the North Shore Healthcare Foundation and Cook County Higher Education. We have staff participating in ASSIST training, which is a more advanced suicide intervention training modality. And we'll have a lot more to share on our activities in health promotion and substance use prevention at our May Public Health and Human Services Board meeting, where we'll have staff report on some of the activities that they're undertaking within that Rural Communities Opioid Response Grant Program through the federal HRSA, Health Resource Service Administration. Ooh. The Federal Health and Human Services.
We don't know, you can make
Agency.
it up.
I was going to say the same thing.
Also, from our public health team, a lot of time and effort going into our 5-year community health assessment and health improvement plan. We are expecting to announce a series of hybrid meetings in which we'll invite community partners and members of the public in to review that draft report, get feedback on some of our identified goals and the data that we've pulled to address some of the health concerns within the community. Lastly, I want to give a heads up on an opportunity that we were presented with on a regional level to provide regional lactation support. We don't have a formal ask at this point, but again, I just want to introduce this idea, let you know some of the work that we've been doing regionally and locally to assess whether this would be a viable option for our staff. Historically, a regional contractor was in this role through the Community Health Board, the Cook, Lake, Carlton, St. Louis, 4-county Community Health Board, providing regional lactation support. What does this involve? It involves convening a coalition, a regional coalition, communicating with labor and delivery and postpartum staff at hospitals throughout the region to ensure that referrals are made to public health nurses for follow-up services, some community outreach in the form of a regional breastfeeding newsletter, working with the Community Health Board to host a regional breastfeeding summit annually to provide people supporting lactation with continuing education opportunities, working to support policy, systems, and environmental changes regionally related to lactation as outlined by the Statewide Health Improvement Partnership, or SHIP. Most recently, this staff person was located within Carlton County, and then prior to that, a Community Health Board staff person, but found that that position wasn't a good long-term fit for either role. So this has been an unmet need within the region recently. Grace has been in conversation, Grace Grenager, our public health supervisor, has been in conversation with Susan Michaels, who is the Community Health Board Director, and our local SHIP coordinator, Christina Matson, to assess whether that would be a good fit within her role. So conversations that have taken place today have been about the scope and purpose of that regional lactation role, how this aligns with Christina's role as our part-time SHIP coordinator here with Cook County PHHS. So what this would look like would be a change to Christina's position. She would become a 0.5 FTE SHIP coordinator at 20 hours a week. Currently, she's at around 24 hours a week. And then using grant funds from the region would increase her position by 0.375 FTE, so an additional 15 hours a week, acting in this regional lactation support specialist for Healthy Northland, which is our regional statewide health improvement partnership. This could start as soon as mid-June 2023. Again, grant funds available through the region to increase Christina's hours in alignment with the statewide health improvement partnership, policy systems and environmental change work, a lot of work with workplaces, healthcare systems, definitely within Christina's experience and skill set. We don't have a formal ask associated with this today, but wanted to let you know that we are in conversation exploring this opportunity for our team.
That's really exciting. And one of, let's see, I think it was an employee of the Department of Corrections or probation. One of the supervisors there was in a conference about prevention, and the question was asked to the presenter, if there is one thing or at one time that we can do more for preventing people from kind of straying off the legal path or just getting into the trouble, what would it be? And they said prenatal care, which is a little counterintuitive to probably a lot of people, but the rationale was that we need to support mothers, families, babies from the get-go, and the next step after that clearly is lactation support and that kind of coordination. And so and just now learning more of that 80% of our brain's development is before the age of 3 and 90% is before the age of 5. It makes a whole lot of sense to invest early on with that. And we know so much more about breastfeeding now and the benefits and how important it is from the social standpoint of connectivity, as well as just the gut biome, about how that affects our mental health even. I mean, it's just really, really broad. So it's an exciting prospect. We'll like to hear more when things are discussed further. Oh, please, Commissioner Hawkins. Yeah.
Question about that. Sorry. So I agree, prenatal childcare is important. I'm curious about this position being based in Cook County and being a regional position. It kind of is counterintuitive to me to say this person working out of Cook County is going to do a lot of traveling for a few hours a week to do this job. And I think of St. Louis County, traveling to regions in St. Louis County. To me, it just doesn't make sense right off the top here. So I'll need some more why this works for Cook County to take this position on, rather than some of the larger counties that have more resources and less travel time. And I'm curious, if this position was at the Community Health Board level, why didn't it work? So those questions off the top of my head, so when you have the report next month, those are what popped into my head just like that.
Well, I think it was Carleton County that it didn't.
I thought it was Carleton, then I went to the Community Health Board. I thought that's what you said, but
Yes,
that
it
was
was
my first.
housed in both Carleton County and the Community Health Board. And to your point about travel, I'm getting messages from Grace here. She's tuning in, keenly interested
Nice.
in this discussion.
Thank you, Grace.
And this was my assumption as well, but it's great to hear this confirmed from Grace via her conversations with Susan at the CHB, is that the work would primarily be remote, providing support to these workplaces, healthcare entities, counties, and others. As so much of our work is now on Teams, on Zoom, via phone, there may be a small amount of travel, again, that would be built into that budget for the position.
Commissioner White.
45 years ago, at least, there was a real, have you ever heard of the La Lechili?
Yes.
Yeah.
So to help a new mother with breastfeeding her child on a Zoom meeting seems a little, you need hands-on. You need somebody there to be supportive, and so I just really, I mean, what happened to all these other,
I was going to say I was a member of that at the time, but it is, in these days, it's about being at work and still nursing your baby and providing a private room. I mean, where I last worked before I retired, there was a woman who was actually just sitting at her desk pumping, and no one knew because there was no private place for her to do it. And that's, I mean, to me, it's remarkable that people can even live that way and do all that, but they do. So it's not just the mother and baby, it's the community that needs to learn about this, right?
Yes, absolutely, Ran. I appreciate that distinction. This position, this role would be very focused on that higher level policy systems and environmental change, working with organizations, say the Cook County, for example, ensuring that we have space for parents to express milk or nurse, that it's private, that people are getting their legally entitled breaks in order to do that. It wouldn't be providing that direct counseling and support locally and in many other counties throughout the region. That's provided by the WIC, Peer Breastfeeding, peer, or family home visiting nurses.
Which we
Great
have
question.
Hannah Miller in Cook County.
I was thinking too that in a lot of communities, I think that would be provided by the hospital where people give birth, but we don't do that here. So we need it in a different way.
I will say as well that you might remember pre-pandemic, our staff were involved in a local research project, Rural Mamas Connect program, in which interviews and focus groups were conducted with families who had had babies within the last 3 years. Workplace support for breastfeeding was one of the priority unmet needs that came out of that study. And again, locally, a lot of that is due to the nature of our economy and that it can be challenging to provide those accommodations for people in the types of industries that are common here in our community. So supporting employers and healthcare professionals, both locally and regionally.
James.
Thank you. Allison, a quick question about the medical assistance renewals.
Yes.
Just wondering, I know that process is initiated generally by the person with the coverage, but I'm wondering how much of you said there were like 1,700 some folks who will need to go through that process?
Yes, 1,200.
1,200.
1,200, okay, I'm sorry, I misheard. So that's a lot of folks, and I'm just wondering like what kind of staff resources do we expect to need to assist in that process?
So we anticipate that it will be a significant increased workload for our team, but the one that we can absorb perhaps with some additional overtime, but not with having to bring in additional staff, train additional staff, as is the case in other counties with much larger volumes. We have 4 staff currently and a supervisor that are trained. This will be new for some of our recent hires who have never conducted eligibility renewals. But we're confident that between our staff and with the partnerships that we're continuing to develop at Sawtooth Mountain Clinic with their MNsure navigators, that we can meet this challenge without bringing on additional resources.
Sounds like a lot of work.
It is a lot of work. If you want to stop by our office and come through the West Wing, which is a federal tax information area, so you'll have to get escorted. Allison, our supervisor, put together a nice visualization of the number of renewals anticipated for each month over the course of the year. So it's a creative way to communicate within her team and provide that light at the end of the tunnel as we get through this large volume of work over the next year.
part. I've got trust and faith, but also concerns about burnout, right, with overtime, but yeah, I appreciate how you're addressing it and how the team's addressing it and looking at it from all angles there.
I will say too that we're still continuing to learn more from the state about expectations at a
Sure.
state and federal level for rolling out this work. One of the recent changes is that we need to be able to take renewal over the phone. There are both technology and staffing implications for that are primarily being led at a state level, but that may change how we staff this process as well. We might look at training additional staff and the ability to take a renewal, really partnering across our human services team with people who are enrolled in waivered services or in residential treatment programs, for example, really ensuring those people with ongoing medical needs have continuity of care during this time.
And certainly it is a burden too to onboard even temporary people and train, right? So yeah, I appreciate you and the team weighing the options there. Great. Any other, was that all, was that the all of it?
That is it, except for my explanation of our 2 items for board action.
Okay.
So happy to take any other questions on my report.
Think we're good to go? Thank you.
Okay, so the first item for board action before you this morning is a request, again, at a regional level to add a commissioner representative to the SHIP, Statewide Health Improvement Partnership, or Healthy Northland leadership group. Information in the meeting materials included the scope of work for this leadership team, as well as the time commitment. So I would be looking today for a nomination to designate a commissioner representative to serve on the Healthy Northland Statewide Health Improvement Plan Initiative Regional Community Leadership Team.
Any volunteers? Any thoughts? Mr. Hawkins?
I would volunteer.
Hey, right on. I'll make a motion to
Thank you.
appoint Commissioner Hawkins to the leadership team there.
I think this would be a good opportunity for me to learn
Yeah.
more regionally about the work. So when I read this, I thought, ooh, really, one more thing? But kind of made me excited, so.
Good. That's, yeah. I was excited and I had the same reaction like,
I thought I might have to arm wrestle you, but
No.
I did look through. If
Yeah.
they are open to more members, so.
I think,
'Cause I kind of thought, well, maybe I can do that. If I don't get appointed, I'll just lurk.
Do we need to second?
there is a motion as their support.
I'll second it.
Thank you, Commissioner White. We have a motion and support. Any further discussion? Okay, thank you, Rana. Any further discussion here? Hearing or seeing none, all in favor? Aye. Opposed? Motion passes unanimously. Thank you for stepping up. Appreciate it. That'll be a good process, and you will definitely get to be more involved with the regional public health side of things. And
Good for
yeah.
my training.
Yeah, for sure.
Do we need to have an alternate, Mr. Chair?
Oh, that. it
Usually when
didn't-
we have
yeah,
an
that's-
appointment,
That's
we have an
wise. Thank you for that suggestion. Is there another volunteer who would like to be an alternate? Else I would happily be.
Commissioner White?
I'll be the alternate.
Oh, right on.
She's dependable. I'll never be needed.
I'd like to make a motion that we have Commissioner White serve as our alternate.
Excellent. Is there support?
Support.
Thank you, Commissioner Storlie. A motion and support. Any further discussion? Really appreciate you also stepping up. We'll see, probably won't have to, but.
I know.
But there's an opportunity.
But I have to
You'll
s-
get the links and
I
all
have to
that,
stay
you know?
abreast of what's
Yeah.
going on, so I,
Yep, that'll be awesome. All in favor?
Aye.
Aye. Opposed? Motion passes unanimously there. Most excellent. And that goes on to the Sawtooth Mountain Clinic amendment here.
Yes, I'm happy to give a bit more background
Okay.
again on that amendment to our existing clinical supervision contract with Sawtooth Mountain Clinic. So John, as you know, in his recently hired role as our behavioral health and clinical supervisor for the department, supervises the day-to-day work of our team, which includes both clinical consultation and clinical supervision. Last month, you approved a request to contract with Lisa Sater, who is a new service provider in our community with a great deal of experience and specialization in early childhood and youth mental health. So that consultation agreement that was approved with Lisa last month formalizes that agreement. It allows us to build in regular time to consult with Lisa on shared clients and within her area of expertise. We are also requesting today to amend our current agreement with Sawtooth Mountain Clinic to modify that agreement from a clinical supervision agreement to a clinical consultation agreement, similar to what we currently have in place with Lisa. Historically, we contracted with Sawtooth Mountain Clinic to provide that clinical supervision of our case management staff as well as case consultation, as we previously didn't have a licensed mental health provider on staff. Prior to that, Human Development Center provided a wide range of services within the community, including therapeutic services, consultation, and our county grant contract that we had in place with HDC subsidized those services significantly. So the request today is again to amend the contract with Sawtooth, modifying that agreement from clinical supervision to clinical consultation so that we can maintain regular communication with their therapists for mutual clients. So individuals who are receiving therapy services from Sawtooth and also receiving case management services from our staff.
Great, seems pretty straightforward. Are there any questions, concerns? Please, Commissioner Hawkins.
I want to thank you for answering my questions yesterday with my emails, because this is confusing for me. But I realized this morning I have one more. Okay. Well, actually, a couple more, but the one I want to ask right now, so these consultations that Sawtooth Mountain Clinic is providing to our staff, is it one-on-one consultations, one per staff member per month, or is it as a team, one time for the team?
The way we have it structured is a regular group-based consultation, but there may be times in which there's a urgent or emergent need in which our staff may need to reach out to one of the clinicians, and this would allow us to compensate for that time as well. The clinicians are very busy. The group consultation is held on a regular basis, so that's built into their schedules, both on our case management staff and on the clinician's end. So again, regular group consultation, but with the ability for one-time individual consultation as well.
And I'm wondering how our behavioral health supervisor works into that one-on-one and making sure that, chain of command and knowledge shared. Will that behavioral health supervisor be involved in that consultation?
He would be involved in the regular consultation, the scheduled consultation. If it's a one-off or a as needed, that would depend on the circumstances. If he's available, I would imagine that would be the supervisor guiding that staff to consult with the therapist. So that would be a part of, he would be directing the staff person to
Okay,
consult.
that's what I just wanted to make sure, that the staff person isn't just communicating without going through the supervisor and knowledge of what we're, chain of command, I don't know, who's in charge. And do we get reimbursement for any of these consultations?
That is something that we're actively exploring as we build our capacity to provide that clinical supervision internally, whether or not we can build a state or a health plan for John's time providing that clinical consultation, that clinical supervision. See?
No wonder I was so confused yesterday.
Historically, we had not built, it's to my knowledge, Sawtooth Mountain Clinic wasn't set up to build a state for the clinical supervision that they were providing to our staff. So this is, again, a new opportunity as we have that licensed staff person.
And how close are we? Because we hired Kristen Hale to start it, and now we've got Mr. Speaker working on that. How close are we to being able to bill?
I don't know that I can give a timeline for that. Kristen's work was really at a high level, looking at some of the theory behind community mental health services based on her experience with Ascend, the relationship between a therapist, a case manager, and a skills provider within that ARMS, adult mental health, skills work, and children's therapeutic skills services. So she provided some recommendations within the context of a community health clinic. We're still in the process of integrating that within our team, which is a county system, and as you heard from Lori this morning, has a different reporting systems and structures, registration processes. So we're still in the, I would say, the early stages of that. Exploring whether or not to become certified for some of those other community mental health services. I think clinical supervision will be a bit more straightforward in terms of the registration and certification process with the Department of Human Services.
I guess, Chair?
Yes, please.
I would like maybe, I'm curious on this board. We've talked about ARMS reimbursements for, well, since I got on this board. And I kind of like to have an update to the board at some point of where we are in our process, because we've done this a few times now. We're talking about, and now we have a supervisor.
And a team.
Yeah, that's licensed, and I guess I would just like to have an update from that perspective of, hey, this is where we were, this is where we are now, and this is what it's going to take to get where we want to get.
Okay.
Just want a future agenda. You know,
Yeah,
have
that sounds great, yeah. Commissioner Wright, you had questions?
They were all, it was answered.
Oh, okay, great. Any other questions regarding the amendment to the clinical, or the contract here? It looks like the greatest change is $1,600 potentially annually. But I really appreciate the partnership between the clinic and the county, because that kind of communication for continuity of service is critical, just to make sure, as Commissioner Hawkins pointed out, that everyone's on the same page, whether it be supervisor or staff or other providers in the community. We're all working towards that same thing, so.
And if I may, Commissioner Mills,
Please.
mention that even with the addition of the clinical consultation agreement with Lisa and the modification to our agreement with Sawtooth, we are within our budgeted expenditures for purchased contracted mental health services for 2022.
Great for pointing that out, thank you. I should hope so. Very good. Is there a motion here?
Mr. Chair,
Commissioner Sullivan?
I move to approve the addendum to the master contract with Sawtooth Mountain Clinic.
Thank you. We have a motion. Is there support? Rana, thank you, Rana. Motion support. Any further discussion here? Hearing or seeing none, all in favor? Aye. Opposed? Motion passes unanimously. Thank you. That moves us on down to our committee reports here, and we have some time this morning, so that feels good. Active Living Steering Committee, Commissioner White.
The Active Living Steering Committee, wait, I'm finding this here. This makes me look important. Active Living Steering Committee. Christina Mattson chaired that. And it was this time around, there was a discussion also about the Gitchigami Trail west of the Grand Marais, and I mean, there was a lot of discussion, but it was, at the end of the meeting, it was suggested that the Gitchigami Trail and their issues with erosion and everything probably shouldn't be part of the active living agendas, because it was more with the DNR than with the active living group. So, safe routes to school. Charter school is having an expansion, and so there was a lot of discussion about access, safety and access with the new Gunflint Trail and an entrance that goes into the Great Expectations and parking. Sheriff Eliason was there to answer some questions about that. The one thing that there's a lot of emphasis on bicycle safety for kids and adults. And there is what they call a bicycle barn, where evidently we have bicycles to help with not only just teaching, training, this is how you stop, this is how you, for bicycle training, there is also bicycles to be used. They're stored up behind my understanding, I didn't want to interrupt the flow of their conversation, but it's up behind ISD 166 by the tennis courts on that end of the building. There is a location, perhaps you know where that is,
I think it's a
Commissioner?
metal shed.
Oh,
It's out there.
metal shed with bicycles in it. So that was, they're calling it a bike fleet. It's by the shop area. They're working on trying to get some gift cards for all of the crossing guards for the work that they do, rain or shine. And they're going to be doing with the bicycle training again. They're going to be doing this during the school day, in the school day, so it's not an after-school thing. They're trying to get to all the kids, everyone.
Cool.
As far as the safety ship, I don't know what that is.
Statewide Health Improvement Partnership.
Thank you. The Highway Department, Robbie Hass reported that he got funded with a state grant for, he was speaking in acronyms, so I didn't get the whole thing, for AT something or other, but it all has to do with creating safe routes, getting roads and intersections so they are visibly safe for any pedestrians, one way or the other. Also talked about pedestrian signs and what they're going to be needing. There was a concern about the upcoming big street project, Fifth Avenue, and what needs to be done for pedestrian safety on that and driver awareness. So all in all, it's a very busy group of people, kind of diverse, but all working to the same end, so.
Great.
Okay, that's it.
Thank you. AOA, we meet tomorrow. AHA, I think I updated the group, just that, there was that leg and grant awards and contracts and all that, but that log jam broke through, and I haven't seen any more things I had to sign for that. So that's good news, and hopefully brings a little more stability to everyone under that umbrella. Arrowhead Regional Corrections, Commissioner Hawkins.
We meet on Friday. There's nothing new, just regular business.
Nothing since the sausages, right?
Will you be
Yeah.
bringing?
Although, my boyfriend said yesterday we ate the last of the last ones. He says, "Can we buy more on Friday?"
Yeah, there we go. Nice.
I think we can.
We got you hooked.
Give you some money.
Do a run. Child Care Solutions Subcommittee, Commissioner Storlie.
Yes, we did meet, and we're moving along with providers up to 21, and that includes Portage. And it was a small group, so we had some short discussions. But here's an update. President Biden is planning to sign an executive order and seeking to make progress on a promise he made, which stalled the first 2 years of the in his office, and it's about child care and long-term care. So it's both spectrums
Yes.
of people in our country. And so the order includes over 50 directives to nearly every agency. And so they're going to take action on fixing our child care and long-term care. And it goes on and on and on. But yay.
That's exciting.
That's big news that he's doing that for sure.
Thank you. And yeah, sorry I missed that meeting. I got the materials, and at our joint leadership meeting, towards the end, you had gone at that point, but I showed just the screenshot of the one slide that was the.
Oh, good.
So that was, which I, of course, wasn't there for, but I think Kelsey Kennedy was there for both, so she
Yeah.
could attest to
Okay,
it. But,
good.
yeah. No, it's great. That's great news, and up in
Yeah.
Grand Portage, too. Community Health Board, I think Allison updated some of that discussion. I also updated previously about the opioids. We were talking about that and the treatment options. And then the other thing I did not update this group about was just the conversation around ticks and bats. And we had a lot of conversation before about ticks and tick-borne illnesses. And so there's this information campaign about the dangers of bats and rabies. And I pushed back just gently, just like, wait a minute, I thought we just got over this hurdle of demonizing bats and recognizing how good they are for everything. And so now we're gonna, but it is important because rabies is, I guess the number one transmission is through bats. So if someone gets a bat bite, which supposedly you hardly ever know if you got it or not, you know. Every time you get a spider bite, it's actually a bat bite. Just kidding. That was a joke. But that is like the number one transmission, and I know there are a number of bats that are endangered here in Minnesota too, so there's a number of fronts going on there. But that was an important public information campaign that's being done regarding rabies. And just that phrase that I shared before, you know, a healthy public equals public safety. And there was a fun quote. I don't know where I got this quote, but I wrote it down near my CHB stuff. We don't see things as they are. We see things how we are, which is just a reminder of our different lenses that we have and looking at different situations. So that's all I got there. Moving on to the local advisory for mental health. Miranda.
All right. Well, we talked about a lot about suicide training, the training that professionals have, as well as information and training that community people can get so that they know how to intervene, when to intervene. Melissa was trained in some of that and gave a really good report on it. And I think that's something that people may not be aware of, is each person does have a role, should something come up, to know how to handle it and how to get a hold of professionals. And it is a big issue that I think everybody should be aware of and know, be comfortable, and not necessarily you can be comfortable about it, but just have some awareness of what role anybody could have. Because there is the new 988 number for the country, but that has some complications too, because it's based on location, and if you have a cell phone with a different number, they may contact a different location than where the person is actually at the time. So that was a very good and lengthy discussion, I think, for all of us. And I can't remember what else we talked about.
That was the bulk.
It was.
And that was the mental health first responder training. Is that what you said?
Partially.
Okay.
No, what was it? It's a different thing.
Mental health first aid.
First aid. Sorry. Yeah.
First
Thank
aid,
you.
yeah.
And I think there's going to be there's going to be more training opportunities. It sounded like it was a pretty successful go at it. And yeah, I missed that one, but I think it is just in our community can be very valuable to know if you can see signs of somebody having a hard time and what we can do to support them and everyone else affected.
Yeah, I know, yeah.
I'll also mention that in addition to the adult mental health first aid, there was also a specific class for youth mental health first aid in which we targeted recruitment towards people working in the schools or in youth-serving agencies. We had a really high participation among school staff, so really glad, again, to be expanding those skills throughout the community for people to help intervene and support someone in a crisis.
Yeah, and people did comment that in a community like this, a small community, people who are experiencing a crisis may call a friend or neighbor rather than calling a professional, just because they know them and they feel more comfortable with them. So then we, as friends and neighbors, need to know what do we do when someone does call us. So that was really good.
And another guest that we had in our meeting last week, was that just last week?
Yeah.
Was Anna Ross, who's one of our social workers,
Yes,
who
yes.
This winter, as a part of her Masters of Social Work internship, led 2 grief and loss support groups for the community that were provided free of charge at the hub and
Yes.
co-facilitated by Melissa Becerras, now at Sawtooth Mountain Clinic, but formerly with our department. So she was able to share with the group about that experience and that unmet need that she's been meeting through her internship work.
Yes, that was also very impressive. Something we also need in this community, I think.
Thank you. Restorative justice. Commissioner Hawkins.
That meets tomorrow. Don't have anything else to report?
I can take on to that one a little bit. I had a conversation with Mike Schmia and Inger Andrews just about the program. They reached out to me, and I was kind of like, why are they reaching out to me? Like, I'm the alternate. But
I have a conversation with Mike, that's my people.
yeah, and it's just interesting hearing about some of their thoughts and the needs that they see and some of the successes they're having, and just some of the comments they're getting from community members who are working with, particularly youth that have been a part of this program. And so they're trying to figure out what is the best path forward for the group. It sounds, well, and you probably knew way better than I do, but.
Trying to structure the restorative justice program in Cook County, and they're working closely with advisors from Carleton County who are very happy with the way it's working there. So there's discussion of what our program might look like based on what has happened in other counties.
Sure. It was really funny because right after I met with those guys, I met a community member, and it was in Duluth, just randomly. And they said, what is, they were a little critical about where this program was landing. And I was like, well, I think it's just a kind of, not a pilot necessarily, but they're just trying to figure that out and get it going and build it. So I don't know that where it is where it is, but I think is that what they're exploring with Carleton? Because Brainerd Lakes is another area that they're saying, that's more contracted or something? Or?
Yeah, it's run differently in different
Right,
areas.
yeah.
And so finding the best
The right
fit
spot.
and for Cook County is still being discussed and worked out.
I didn't realize Mike was in that role, and it was really exciting. I thought, I was just like,
He's very passionate and he's, you know.
he's got, he has experience and he gets it. It's just, yeah, it's good stuff. Council on Aging, Commissioner White.
Council on Aging continues to rebuild themselves. They're working on getting, they just got the Public Health and Human Services. They were just the one awarded a grant. That was I don't know the name of the grant.
That's our public health fund, in which we align request for proposal to community nonprofits with our community health assessment and improvement plan.
Right,
So
and
that
then-
recommendation was approved last year, but they likely just got the check at the beginning
Yes,
of the year.
yes, so they're very relieved about that because they don't have any money. So, but they do really well with what they're doing, and they're working on trying to do fundraisers and making use of the space that they do have. And they're seeking volunteers. There's a garage back behind there. When the snow melts some month, it needs to be cleaned out. So if anyone's interested in cleaning out decades worth of things, and it's things unknown at this point, go on down. So, yes, and they did bring up the grief, the woman who was in there with that, and they did not know at that point, nor did I, that it was a temporary, it was part of what she was doing, but they thought it was a good addition to what is offered down at the hub. So there's no end to ideas from that board as to their way forward for the community. So,
Thank you. I would volunteer, but I think I would probably just bring more stuff to put in the garage.
they will not allow you to do that.
Yeah, okay, good.
And I don't think there's any room to get anything more.
Emergency preparedness, Commissioner Sullivan.
Well, as Allison mentioned, we have the 31st Annual Cook County Emergency Services Conference coming up a week from this Friday and Saturday. And in addition to the programs that Allison mentioned that are being offered by Public Health, they're going to have a discussion on what we've learned through the pandemic and the extended pandemic. And North Shore Health will be providing a presentation called Stop the Bleed training for some of our first responders. We're going to have training on underwater rescues and equipment that's used for those rescues. There'll be a North Memorial helicopter demonstration, hands-on underwater training with sonar in the Grand Marais Harbor. LifeLink is coming to talk about emergency department training. And then we have our Narcan training, which will be available, mental health training, psychological first aid, which we mentioned already, and then there'll be updates from the U.S. Forest Service and Minnesota Department of Health and Emergency Management. Arrowhead Electric will be offering a summary of what happened during the Christmas blizzard when we had the lengthy power outage. There'll be Armor radio refreshers and Skywarn storm spotter training from the Weather Service out of Duluth. So lots of activities going on. It's our people that are on fire departments, our first responders, everybody in that area is registered, and then there are a few additional registrations which are available on our website if anyone would like to participate. So again, a week from Friday and Saturday, that'll be at the community center.
Here in Grand Marais.
Correct.
And could one just attend and,
You have to register because there's limited seating available, limited spots. So make sure you get on there and register if you're going to attend.
Thank you. Healthcare Planning Committee, Commissioner Storlie.
We had a small meeting, and I would say the exciting news from this planning committee is that there were 7 bison delivered to Grand Portage. They're pretty excited about that. That was something they've talked about for a long time, and finally the little critters arrived. So we'll see how they all adapt to our snowy country coming from, I think, North Dakota. Should be easy to adapt from that, I would think, but anyway. That was pretty fun to hear about, and that would be it. Going on to NACO, because I had another Zoom meeting, I wasn't able to attend NACO this month, but hopefully next month.
I chatted with Brian Larson's son, Adrian, in the sauna about, he said he went with Brian up to see the bison, and he said, they're super cute. And I said, you mean just the little ones or just the babies? He's like, both of them, all of them. I'm like, okay, well, that's fun.
and the bison are all female that they got delivered. And
Oh,
they have
interesting.
And they have a male that will be joining them after these ladies acclimate.
Interesting.
Yeah.
They're part of the Yellowstone herd.
Okay.
So
Yeah, I didn't know any of that. I had questions about that.
You only cared about their looks.
I know. I am a superficial being. Let's see. Northeast, Jet. We'll call it Jet.
Oh, Jet. Yeah, another one that I never know what it is. Actually, we didn't meet, but I have a note here. I'm going to ask you because I have a training that they're going to train me about what they do, and I want to talk to you about this after the meeting. So
Okay.
I put this date.
I won't run away. North Shore Collaborative. I just got the call for partner updates for that, so that means we're meeting soon. And so this is my chance to give kind of that call out for grant requests to serve our community up and down the shore for any community partners out there. And I'm assuming there have been people requesting because it wasn't specifically asked for us to ask partners this time to do that. So hopefully, we've got people kind of in that loop and on that quarterly schedule now, looking for those opportunities. But I'll report on that after I find out. PHHS Advisory Council. Pat's not here today. Could you give any update? Ann, were you able to attend or?
I did not.
Oh, okay.
We did not meet in April. That group meets every other month.
Well, there we go.
Pat updated us in March, and we'll meet again in early May.
Thank you. That's easy then. Anything else for the good of the order here?
I can mention as an aside to the PHHS, Public Health and Human Services Advisory Council. Commissioner White, your comment evoked for me the memory of Joni Christensen, our long-serving public health nurse, and she had a great deal of pride over the fact that we were still Cook County Public Health and Human Services, whereas many other counties in the region are Health and Human Services. So she too really valued that public word in our department title. So thank you for reminding me of that. What was I talking about? Public Health and Human Services Advisory Council. A task force of that group is advisors to our department as a subcommittee and to this board as it relates to those community grants to nonprofits. And we did recently send out a request for year-end reports for recipients last year, and we'll be initiating that process again this year, co-designing that request for proposal, and any updates to our process application eligibility guidelines for the 2024 budget year.
Great.
Something else I wanted to mention in my staff report that I neglected to is that I will be providing an updated organizational chart at our next meeting as we are welcoming a lot of new hires. You saw some versions from Lori this morning of the year end, so I didn't want to overwhelm with yet another org chart. So next month, you can expect that as a part of the meeting materials.
Yeah, and I was asking Allison in our meeting just before this one, or about this one, just if we could have that included regularly in our meeting packet, because it would, I think, help us remember, okay, this is how this is structured, and this is how this works, and this is who that, all of that. I think it'd be really helpful. So we'll try to keep that in the packet if we can.
I appreciate that. I was looking at my org chart that I have at home on my own personal computer, and I realized I have it so messed up. I am just going to delete that one and start over because of the changes and the transfers, and I messed something.
There was a lot.
And because of the changes and trying to remember the titles. Of
Right.
people, I've been messing that up, so I appreciate helping me figure it out.
Yeah, job titles is one of my weaknesses, I'll say that. All right, well, we are down to item 8 here, which happens to be adjournment. Is there a motion?
So moved.
Thank you, Commissioner Hawkins. Is there support?
Support?
Thank you, Commissioner Sullivan. We are adjourned.
Just eat tangerines.